Good morning, everyone, and welcome to Great Day Houston Medical Monday. Supply chain issues, social distancing, wearing a mask, all those things related to COVID are pretty much over. But there is one area where we're still playing catch up, and that's our health. People put off going to the doctor for a couple of years, and while their checkups were on hold, diseases kept growing. That means more people are now being diagnosed in later stages. Also coming to light, issues like breast and colon cancer are striking at a younger age. Our first guest says many times there's a fine line between a serious health problem and one that will take your life. Joining us with how to better manage the outcome is Dr. David Ellent, the CEO of Genesis Medical Group. Good morning.
Good morning, Deb.
All right, you are a specialist in internal medicine, but also a medical oncologist specialist, or medical oncology specialist. So you know what happens when we put something off and cancer is growing in our body. It can go from stage to stage very quickly. Absolutely.
And survival drastically different. Early stages of breast cancer, survival is 90%. Later, 28% in stage 4. Same with colon cancer. So the earlier we get, the earlier we diagnose, the better chances of survival.
Yeah. You know, it's crazy right now because we're seeing younger and younger people who are being diagnosed with breast cancer and colon cancer. And because we've given guidelines of, you know, at whatever age, 50 or whatever, a lot of people will dismiss some symptoms they might be having and think, oh, no, I'm too young for that. Let's look at breast cancer first. Most common in older women, still most common in older women, but what are we seeing with younger women?
We see it more frequently. We see more frequently, especially with familial diseases. And that's why it's very recommended for patients to get mammogram at the age of 40. It takes 30 divisions for by the time the doctor or the patient starts feeling the cancer. It's probably several years.
Yeah.
So the earlier you get the mammogram, the earlier you can detect it, the better survival.
Because by the time you're feeling a lump, you're probably in late stages.
It could be late stages.
Yeah, all right. And the other thing that's kind of troubling is that breast cancer in younger women seems to be more aggressive.
It is.
All right. The risk factors, you mentioned familial. So if you have a family history, by all means, take advantage of those earlier times to get your mammogram. Age, alcohol consumption. But the other thing, I think a lot of people, again, I touched on it earlier, dismissed, if you are having any kind of symptom whatsoever, just come in, rather be safe than sorry.
Yes, especially in Genesis Medical Group, we believe in preventive care.
Yeah.
We believe in the fact that we have to be there for our patients. And we want to make sure that we detect it earlier. The early detections will give life.
Yeah.
And nowadays, even with 2021, there was a new guidelines for colon cancer screening. It goes down at the age of 45 instead of 50.
Yeah, I think a lot of us were shocked when we found out that the actor Bozeman was diagnosed at 39, and by the time they found it, it was late stage 3 going into stage 4. And so, you know, at that age, no one's thinking they have colon cancer. We know that other people who high profile cases, the same situation. All right, it's the third most common cancer, the second most common cause of cancer deaths. But here's the crazy thing about colon cancer. Found early, the survival rate is extremely high.
Yes. So survival rate in stage 1 is 87%. It goes down to 14% 5-year survival if it's stage 4. So it's absolutely necessary. Colonoscopy will save life. Early screening will save life.
Because at times you're removing polyps even before they have a chance to become cancerous.
Yes, absolutely.
All right. Risk factors, age, family history again, lifestyle, overweight, sedentary, smoking, heavy alcohol. Every time I always hesitate to say some of the risk factors because people will check them off and say, well, that's not me, that's not me, that's not me, so it's impossible. It's not impossible. We're just saying there's an increased chance when you have some of these things there. All right. I want to talk about Genesis Medical Group. What I love about this is that, you know, people oftentimes think I go to the hospital. Usually when you go to the hospital, you're probably going to check in, right? With Genesis Medical Group, you want to prevent that check-in. You have not only one doctor to go to, you have several doctors to go to. And I would imagine for you, the nice thing about that is that you have people to consult with as well.
Yes, Genesis Medical Group is like a family that wants to take care of you. So we want to make sure that we do preventive care, not just colon cancer, diabetes, all the diseases that can harm you.
Yeah.
We want to be there for our patients. And going to the hospital is a disaster. It's very disjointed care. We have to be comprehensive care. We want to make sure that doctors know what is going on with the patient.
Yeah, and you may have more than one issue going on. Let's say if you're diabetic, but you're also dealing with cancer, you have a specialist in diabetes, you have a specialist in oncology, and it's all under one roof. Convenience is another thing. To have to go all over the place from one place to the next, a lot of times people will drop the ball and just not bother. But at Genesis, all your medical records, for example, under one roof.
Yes, one EMR, one roof, communication between the doctors. Make sure we use the standard of care. Everything we do, we want to make sure we provide the best medicine.
Yeah, and you can also address the entire family.
Yes, from moms to daughters, we're here.
Yeah. So for all your checkups, and you want to establish that so that if you have someone, we used to have like the one family doctor, right? And that kind of went away. And but today you can do that under the roof of Genesis Medical Group. You have your family doctors all right there, going from youth all the way up until old age.
Yes, medicine became a lot more complex, a lot more different variation, different techniques are developing. So you need the doctors who are specializing in different areas, and that's what Genesis is.
Yeah.
Genesis specializes in different areas.
And again, I don't think any of us know where half our medical records are. It'd be nice to have them all under one roof so you can, as a doctor, look back and say, we saw this issue here. Let's stop it from developing into this issue here.
Yes. And not just the doctors, the best doctors.
Yeah.
That's what Genesis is.
Dr. Ellent, thank you very much for joining us.
Oh, David, thank you.
All right. Genesis Medical Group has a special offer for Great Day viewers. The first 30 callers will receive a mammogram for $125 cash price. $125 cash price. It's a lot more expensive otherwise. Call 281-440-5300. Again, that is 281-440-5300. For more information, you can also visit their website, genesisdoctors.com. They have several locations.